It's great to see you here. I see a lot of people who typically come to these, and there's always some new faces too. So we're grateful that you're here. We offer this once a month, and we develop this curriculum or this content really around what you say to us that you're interested in learning and hearing about. So at the end, there is an evaluation in your folder. If you would kindly, this is as good as I can do, I'm sorry. I'll try to get as close as I can, but I think this is about it. Dr. Morton's going to have on a lavalier mic, and you'll hopefully be able to hear her better than you can hear me. I'm Mary Haynes. I'm the president of the Nazareth Homes. It's always my pleasure to represent the people who live here, the people who come here for care, all of our great team members, and the families who help us do all that we do. We've been in this location since 1976, started, as many of you know, by the Sisters of Charity, really for their own. And long about year 2000, we began to serve the larger community of Louisville. In 2007, we opened a recovery to home program that's been wonderful for us. In 2015, we acquired the Sacred Heart campus in Clifton. That's been wonderful for us. So we're proud of what we do. We're very committed to it, which is why we enter every possible competition that we can, so we can demonstrate how much we care. We put ourselves under the microscope, and we want to gain your trust, and we want to keep it through our service. For the last few years, U.S. News and World Report, they grade us in the top 10% of all skilled nursing centers across the country. Again, we're serious about what we do. We're committed to it. For the last few years, we also received a Top Workplace Award. That's from surveying our team members, because really nobody cares if Mary Haynes comes to work today. People care about the people that give them care. That's who matters. And that's who spreads the word about us and who really make us deserve to be proud. So thank you for your time here this afternoon. Next month, I'll be on the program with two of our other great staff, Gretchen Houchin, who's out at the table, and Hannah Brunderman, who's new on our team. We're going to be starting two new business lines, one of them being home care, not home health care, but home care. And the other will be a concierge care management type of service. So again, we learn by what you tell us you need. And so we've been hearing this message from the community loud and clear, that more and more people want to stay at home. They want to be able to trust who comes to home. And generally people just need to know what to expect. And none of us really want to be in the advice business, but at the same time, we know things. And we know things that we learn every day that you really need to know. So we'll be talking about that next month. So this afternoon, it's my pleasure to introduce you to Dr. Laura Morton. Dr. Morton is one of the few geriatricians in Louisville. We need more. We're glad we have her because she is absolutely top-notch. Dr. Morton and I had a chance to serve on a committee that lasted about 3 years. We've served on some other things in the past, but I truly appreciate her. She has a great view of how to be supportive of folks like us who are 65 and older, and really to guide us in the right direction. She's a wonderful physician and a great speaker, so I really appreciate her being here this afternoon. Thank you.
Okay, can you all hear me a little better with this mic?
Yeah.
Yes.
Very
Better
good.
than Mary and every.
Yeah.
All right, well, Mary, thank you for the warm introduction. I'm happy to be here. And I'll walk around a little bit as I speak. And if you can't hear anything or something you want me to clarify, please raise your hand and let me know. So So I'm here today to talk about optimal aging, and aging is an opportunity. So we'll go through some slides, and we'll have time for questions. And if you have anything really pressing during my talk, please raise your hand and let me know. So these are the objectives. We're going to go over a few topics, and we'll get there today. But first, I wanted to start out with reading a poem to you all, just to put us in the mindset for today. So I'll have to read from the book. The poem is called Essence. 68 years I have survived wars, depression, hunger, unemployment, loss of father, mother, child. At last, I am ready to live. Now I see more clearly the river of life flows onward. People come and go, friends, children, family, like actors in a play. What will tomorrow bring, or yet today, what may I see? There will be storms, drought, heat waves, cool spring breezes. Each will pass away. The secret is revealed. In each person, season, trial, and event, there is a lesson to be learned, a quality to be savored. Rejoice, but do not cling too fast. Seek the essence, find the joy, explore the exquisite pain, taste depression and delight, as each will pass your way. So I just wanted to read that to you all, just to get us in the mindset of thinking about optimal aging and how we age well. So why is this topic important? Well, you all are here, so obviously you have an interest. So this is my grandmother, and this is why I do what I do. So I am a geriatrician, and geriatrics for me is a calling. And what's most important to me is helping older adults. As Mary said, that is a passion, and I love to talk to older adults, help older adults, and educate others about that. And this is my Nana, and this was her first experience with a selfie. So we got to take a selfie, and this was the Christmas before she passed away. So it was great, and this is one of the reasons that I'm here. So we'll talk about some statistics and demographics, which you all probably already have a feel for. So the U.S. population over the age of 65, grew 5 times faster than the total population from 1920 to 2020. So this is based upon U.S. Census statistics. 55.8 million were over the age of 65 in the United States in 2020, or 16.8% of the U.S. population. In 2023, 11.2 million over the age of 65 were in the labor force or actively seeking work. So how many people in this room are working part-time or full-time and over the age of 65? So some of you, absolutely. I see more and more of my patients, actually, that may be working into their 70s, their 80s, some people even into their 90s still working. And this is a way to look at this from the United States. So Kentucky's in blue. So this is the persons age 65 and older as a percentage of the total population. So Kentucky's 17 to 19% of our population is over the age of 65. And this is a really interesting graph to show the number of persons age 65 and older going from 1900 to 2022, which is that 57.8 million, and they're projecting from 2040 and 2060, by 2060, that people over the age of 65 will be 88.8 million people. So that's a lot. And as Mary talked about, people are seeking other ways to look at healthcare, living, and aging in place. I think that's because the demographics are changing. The population is changing, and our health system, as it stands now, I don't know that we're sure how we're going to manage that. So I'm going to talk about a few definitions today. So optimal aging. We throw around this term, but I want to give you a definition. So the capacity to function across many domains: physical, functional, cognitive, emotional, social, and spiritual, to one's satisfaction and in spite of one's medical conditions. So this is how we define optimally aging. There's also some terms, if you look things up in the literature about this, called successful aging, which seems pretty similar. They all kind of go hand in hand. It's the absence of disease and disability, high cognitive and physical functioning, and active engagement in life. So we can see where they're complementary. And then flourishing, a state in which an individual feels positive emotion toward life and is functioning well psychologically and socially. So we can think about optimal aging and successful aging and flourishing. How do we help people do that? That's the goal. And you all may be familiar with Betty Friedan. She was a women's rights advocate, and this is a famous quote from her: "Aging is not lost youth, but a new stage of opportunity and strength." So changing the way we think about aging. So what are some of the secrets of long life? I'm sure I could ask some of you in this room. You may know some people who have some secrets. Good genes is always a good place to start, right? Our genetics, that's what we're born with. We can't modify those. Good habits. We'll talk more about good habits today, but those are things that are within our control. If you adopt the right lifestyle, you can actually increase how long you live. You can improve your life expectancy. And there's been research that's been funded by the National Institute on Aging, looking at several regions across the world where people live significantly longer. And you may have heard of these blue zones. There's now 5, but I will focus on the initial 3 that were reported and described in the literature. People who are in the blue zones reach the age of 100 at a rate 10 times in other parts of the world, okay? So there's more people there that live longer and they live well. So they've done a lot of studying on these. There's books out there, if you look on Amazon, about the blue zones. And there's 3 regions. The first one, Sardinia, Italy, okay? They drink red wine, in moderation, of course, so that's an important caveat. They share the work burden with their spouse, and they eat pecorino cheese or other things that have the omega-3 foods. So those are the secret there. Okinawa, Japan. There, they keep lifelong friends. They eat small portions, and they find purpose. And in this part of the world, they have a saying which I wouldn't dare try to repeat because I'd probably mispronounce it, but that when they sit down to eat, to remind themselves to only eat about 80% of what they have, so that they don't overeat. So that's they have a mantra that they say, to remind themselves to eat those small portions. And then Loma Linda, California. And they're Seventh-day Adventists in this group. They eat nuts and beans, they observe the Sabbath, and they have faith. So these are areas and these are things that they found to help live a longer life. So all 3 groups, what do they have in common? They didn't smoke, they put family first, they're active every day, they're socially engaged.
I work in fruits, vegetables, and whole grain. You just passed over the Seventh-day Adventists at Loma Linda was number 2 or whatever slide this was. I am fascinated to know. Can I go back again? The blue zones are what?
So the blue zones are just areas that have shown longevity. They have a higher rate of people that live to be in their hundreds.
The blue zone people.
The blue zones. So these are just areas throughout the world. There's Costa Rica is another one, and they're just areas where they found that people, there are pockets of people who live longer, and so because of that, they put funding into it to learn more about.
I wish to reinforce that one that we went through so fast. That Seventh-day Adventist theories: eat beans and nuts and have a good thing. I have worked all over this country, and I worked with those people. I mean to tell you, they are the most stellar medical group that I have ever encountered. Have you had relationships with them?
Well, not with the Loma Linda group specifically, but with Seventh-day Adventists, yes.
With the Seventh-day Adventists, yes. Wonderful, wonderful hospitals and very dedicated and wonderful people. Thank you.
Well, thank you. And let's see, the other thing here, they're socially engaged and they eat that balanced diet, the fruits, vegetables, whole grains. And so this is a little cartoon. how do you keep yourself looking so young? And she's wearing a mask of her, what I would imagine was her younger self. So what are some characteristics of older adults? We think about avoiding premature complications related to aging itself or diseases. We want to remain independent in spite of functional losses and any illness that may come up. We want to remain productive in society, whether that's working, whether that's productive in our family circle, our friend circle, church, or volunteer community. We want to maintain our economic resources as long as possible. That's really important as we're balancing things and on retirement and fixed incomes. We want to retain our cognitive and creative skills. And we want to adjust to losses and trauma that happen just by the aging process. We also encounter a lot of complicated patients, or people that are older that have a lot of things that happen over a lifetime. They're very diverse. As I tell my learners, if you've seen one 80-year-old, you've seen one 80-year-old. It's very hard, you can't generalize, everybody's really unique, which is why it's so important that when you seek care, that you find a healthcare provider that really tailors to your needs, that looks at you, all of you, the whole person, and looks at and tries to tailor things to you. Because again, everyone's very unique, and if you've seen one 80-year-old, one 90-year-old, you've seen one 80-year-old, one 90-year-old. There's obviously more medical problems, more comorbidities that happen over a lifetime. There's more complications from medical interventions. So that's what we call iatrogenic. That's things that happen because you had a surgery, things that happen because you had an adverse reaction to a medication. There's more need for a social support system, whether that's a family circle, whether it's a friend circle, whether it's a chosen family system, your church family. There's different goals of care. Everyone's wishes are different, and we as the healthcare system need to help honor those wishes. There's adverse reactions to medications, and then polypharmacy. And I know there's been talks here about polypharmacy in the past, but that's anyone who takes more than 4 medications. So that's pretty common as people get older. So what are some challenges that we see with aging? Adapting to retirement, new family roles, learning to live with chronic conditions, accepting diminished capabilities, things you may have been able to do before that you can no longer do, surviving the death of family and friends, and coming to terms with your own mortality. Again, that's all part of this challenges of aging. There's also social and financial issues. Sometimes our older adults are caregivers, whether you're caring for your spouse, whether you're caring for children, grandchildren, great-grandchildren. We're seeing more people that are raising some of their grandchildren and great-grandchildren, or whether you need a caregiver yourself. Surrogate decision makers. So who makes decisions if you can't make them? Who would you have or want to be able to express your wishes? We have to acknowledge that there's caregiver stress, whether it's the person taking care of you or you taking care of somebody else. And then finances, of course. And we talk about honoring your wishes, and I just have to put this out here. So it's very important for all people, even the younger people in the audience, that we have a living will. So, advanced care planning is very important. You want to be able to capture your wishes. And that's things like for healthcare is what I'm talking about. What would you want if something happens to you? So those are important conversations to have with whoever your healthcare surrogate is. Whether it's a spouse, a child, a friend, you want to have those conversations so that they can honor your wishes. So it's very important. So if you don't have a living will, those things, please think about it. If you need to have at least a healthcare surrogate who would be able to tell the health system what your wishes are. There's also in the state of Kentucky a MOST form, the MOST form, so Medical Orders for Scope of Treatment. So if you put that in Google, you'll pull up the form. It's bright pink, but it's a way to kind of think through some of those decisions. So If you have some questions about that, happy to talk afterwards about that. So we're here to talk about optimal aging and thinking about a long life and what does that look like? We always say age gracefully, right? You hear age gracefully. There's different people that'll tell you certain things you can do to age better, this diet, that diet, use this app, try this exercise program, right? That's what you hear. Do this, don't do that. However, I think we can go back and look at the basics and kind of reframe how we look at this conversation. So we talk about lifestyle medicine, and it's a way to age optimally. And so there's 6 parts of it, and I'll speak about each one in more detail. But we talk about healthful eating, physical activity, stress management, avoiding any risky substances, sleep, and then relationships. So we'll talk about those. Those are the 6 pillars of lifestyle medicine. So we talk about the whole food-based dietary lifestyle. Really what I would say is a balanced diet, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. So there's been studies that have shown that these things can be used to treat and even reverse some chronic diseases. So these are back to the basics, the things you've heard for years. And when we talk about it, we look at the literature and we look at the guidelines that are out there for treatment of diseases. The first line treatment for most diseases, like high blood pressure, diabetes, obesity, are going back to things like lifestyle changes, so diet, exercise, activity, so those things. And that's often before you start medication, though most of the time you get medication and the doctor will recommend those things too. But so there's good evidence and long-standing evidence that those are the first line things we should be doing. And what are the benefits of lifestyle medicine? Better physical and well-being by reducing the risk of these chronic illnesses, enhancing your overall fitness. Your immune system is actually stronger when you pay attention to these basic things. And it can improve your overall mental health as well. Higher quality of life, more energy, which I think we all would say that we always need more energy, improved mobility, and greater ability to enjoy everyday activities. So, whole plant-based foods, fiber-rich, nutrient-dense. So I think when we give them the choice between the broccoli, like this kid, or the donuts, that can be a tough decision, right? And I think, we have to recognize that we want to try to have the diet that I'm talking about, but that we also have to allow ourselves some grace to realize that we, at a certain age, you've earned the right to have some treats. That you should treat yourself. You're not going to go on avoid those fad diets. It's all about balance. And when we talk about making dietary changes, we talk about small steps, right? Little things. So pick one goal, one thing you want to change, and go with that. Sleep is very important. I will tell you, I'm probably not a good person with sleep habits, but again, this should be our goal, is 7 to 8 hours of sleep per night. Lack of sleep can really decrease your immune system. And as you get older, it's very important to really do the things we can to boost our immune system. A bedtime routine is really important, trying to do the same thing each night. And then getting rid of the screen time. And as people go more and more to their phones, and looking at their phones and their screens right before bed, those are things we should try to decrease. There's been studies that have shown that blue light that you get from those electronics can actually interfere with your sleep-wake cycle. So if you can put the electronics away prior to bedtime, that will help. And exercise. We have to talk about exercise. Regular physical activity is very important. You want to create a routine and schedule it. We all get busy, we get distracted, there's other things we might want to do instead. The goal would be 30 minutes. However, it doesn't have to be. We need small steps. You want to celebrate those little things. So whether we start with just a 5-minute walk, getting up on your commercials and your favorite show, all these things, we can start small and build upon that. doesn't have to be. We think about, oh, I need to go exercise, I need to go run, I need to go join a gym. It doesn't have to be anything that fancy. We can do stuff small, easy, and in our own homes. And if you can make it social, even better. So find a workout buddy, right? That's a way to, really get the benefit of socialization and the exercise. Stress management. So self-care each day. The question I would ask you is, what brings you joy? What makes you happy? What gives you that chance to recharge your batteries? What does that look like for you? It's gonna be different for everybody in this room. A lot of times we look at whether we schedule a vacation, or we're gonna wait till the weekend to relax, or when we get certain things done, and then it doesn't happen. But we should try to incorporate those things into our day every day, so that we're really getting the benefits in an ongoing manner. And you wanna look at self-compassion, and what are your healthy coping mechanisms? And that's where I talk about giving yourself grace. We're not gonna be perfect with all of this. Sometimes things are gonna be a little more overwhelming than others, but that's okay. Just take it one step at a time. And healthy relationships are really important. If there's one thing that COVID taught us all, is how important socialization is, and how detrimental isolation is. So what we saw during COVID is the decline of a lot of people because they were socially isolated, whether it was at home, whether it was in the nursing facilities where we couldn't visit, and there was a lot, and that can contribute to cognitive decline. So make some time and schedule it, spend time with others. It's really important. You're here, this is a nice chance to get out and socialize, so that's a great step. And avoid risky substances. These are the things you've heard forever: don't drink, don't smoke, don't use other illegal substances, they're harmful to your health. If you're gonna drink, you wanna do it in moderation, right? That's the thing about this. So where do we start? All of these things can seem so overwhelming. How do we think about optimal aging? You wanna start with one goal if you wanna change something that you're doing. Start with one goal and you can move along the path, however twisty-turny that path might be for you. And celebrate the little steps. Again, it's about finding joy in what we do. And sometimes it's really not about the destination, but about the journey itself. Whether it's spending time with our loved ones, spending time with our friends, finding a new activity or group to join to have a social opportunity, that's all part of it. So thank you, and now I'll take questions.
All right, Mark, a couple things. On one slide, the 28 challenges to aging. I would probably also add mobility or transportation to that, and then one's own environment or habitat.
Absolutely. So he said to the slide 28?
28.
Okay. So to the challenges of aging, adding mobility and transportation. You want to elaborate a little bit?
Well, yeah, I actually served on a couple age-friendly mobile committee task force, and I used to work with about 400 older adults with the AmeriCorps program, and I know that a lot of them rely on like TARP-3, and other means, and we all know about the TARP-3 troubles and trials and errors with that, so we know that mobility is a huge issue. And if you're in outer areas, sometimes there's not transportation services out there. And then for one's own environment, I was thinking about particular areas of town where there isn't a true, maybe a scarcity of food, nutritional health amenities, hospital, medical facilities, so that can create a problem.
You walking around with that? Okay. So I'll kind of summarize if you all had trouble hearing him. It's talking about different parts of town where there may be difficulty accessing resources, right? So transportation and mobility can be an issue wherever that circle is where you live. There's less healthcare potentially, less, maybe not access to grocery stores or healthy food options. So that's always an important consideration and challenge for older adults. And mobility, and I would even add mobility about how we get around, whether it's in a wheelchair, a walker, who can help with that transportation. He mentioned TARC 3, and I'm sure you've seen all the issues with TARC 3 and on the news. It's been in the news, unfortunately, quite a bit, and the service isn't perfect, for sure. Whether they're late or delayed or they don't show up, it's a challenge. Whether you're lucky enough to have a family member or friend who can take you to your appointments, or you need to rely on, luckily, I guess, Uber and Lyft are around, so a lot of our patients have started using Uber and Lyft, which weren't options 10, 15 years ago. But those are other challenges to aging, absolutely. I think even talking about, it just kind of prompts me to say something about our houses or even our own places that we live. As you get older, steps can become a challenge. If you're in an older home, do you have your bedroom on the first floor? Do you have steps to get into your house? Do you have rails? And I think that's where, having community partners that can help you out, and I think Mary mentioned you all are starting a program to provide some care at home, but looking at what are modifications that can be done to your home to help you age in place and age well in place. Things as a geriatrician that we always talk about are throw rugs. I think throw rugs are a falls hazard for sure. They're a trip hazard because they're on the floor and people kind of get your foot hung up on it. So those are things we talk about. Also, is your bathroom large enough or wide enough so that you can get your wheelchair or walker into it? So those are other things that we have to think about. And home health and some of those community services can come out and actually help take a look at your space and make recommendations. Those are great comments. Other questions?
I'm sort of lost your credentials here before I examine this package that you're an MD, and you had before you a gentleman, male doctor with the same type of practice named, I can't tell you his first name, his last name was Dillon, D-I-L-L-O-N, from the University of Louisville. So are you associated with him, or do you have a private practice? I live here, but if I were in the community, and I wanted to call you a bill or find out about you all, how do we do that?
Okay. Well, I think you were a good prompt, maybe. I didn't pay you to do that, but so here's the slide with the information, the website for Traeger Institute, which is through U of L, so it's up there. There's also pamphlets outside on the table that you can grab. So just about me. So I'm a geriatrician. So I think Dr. Dillon he's palliative medicine physician.
Yes, he is.
So it's a little different. So I did internal medicine residency, and then I did a geriatric medicine fellowship to subspecialize in geriatrics, whereas Dr. Dillon did a fellowship in palliative medicine. So geriatrics focuses on the care of older adults, technically defined as those over the age of 65. We can all argue about what should be the quote-unquote geriatric age, right? I would say that that's getting older, but really as a geriatrician, we take care of anyone that's over the age of 65 or those with those kind of medical problems. So whether it's cognitive issues, a lot of falls, so those are some things that geriatricians take care of.
That's your private office right there.
That's not, it's with the University of Louisville.
I'm sorry, what?
It is with the University of Louisville. So
it is, okay.
So the Traeger Institute's the outpatient clinic at the University of Louisville. My clinical practice is primarily in the long-term care setting. So I work and take care of patients in nursing facilities and assisted living. And then I teach. That's the other part of my hat. So teaching doctors in training, medical students, whether it's nursing, nurse practitioners, because again, there's not enough geriatricians, as Mary alluded to, there's not enough of us. And we're not training enough to take care of the population that's coming, those 88 million older adults that are going to be here. So the people that are going to be taking care of our older population are the family medicine doctors, the internal medicine doctors, the nurse practitioners. And so that's why a lot of us are in academics. So we're associated with universities because we're trying to teach others how to take care of a population that's aging, that's complicated, that has lots of problems. How do we do that and help others learn how to do that? Did that answer your question? Okay.
Do you see private patients?
I do not, but our clinic, so the Traeger Institute, if you look on the website, and then if you all are, depending on
We
how,
didn't hear the question.
do I see private patients?
I'm sorry?
Do I see patients privately?
Oh, yes.
So that's where I said the clinic is our office. And there's a QR code if you all are tech savvy, so there's both ways here. So this will take you right to the website, but the link was on the previous page. So that's where you take a picture with your phone and it'll take you to the website. So again, just to honor that. And you had a question?
No, she got it.
She got it, okay. Yes?
Would you comment on the pharmaceuticals that you deal with, from things like melatonin to Alzheimer's medication?
Yeah, that's a very broad topic, but we can talk a little about medications. Commenting on medications from melatonin to Alzheimer's, so very broad. So as a geriatrician, we talk a lot about medications. I would say that a lot of times the people that come see us, a lot of the problems are caused by medications. If you're on more than 4 medications, that's called polypharmacy. And that includes things that people take over the counter, whether it's a supplement, herbals, so all of that. And so melatonin is an over-the-counter medicine that helps with sleep. It's probably one of the safer things for sleep. Melatonin, so things that you'll see over the counter for sleep, sometimes you'll see these medicines that are called Sleep Easy, and they'll have pretty Z's on the bottle, and it's blue. And if you look at the ingredient, the active ingredient is actually diphenhydramine or Benadryl. And that's a medication that's a higher risk medication in older people. It can cause confusion and falls. So that's one that, in geriatrics we try to avoid. So melatonin is a safer option for sleep. Now if we're talking about the other end of the spectrum and dementia medications, there's a lot in the news now. So prior to about a year ago, we didn't have any of those newer medications. So there's infusions, I'm sure you've seen them. There's lecanemab is probably the one you've heard about the most. And those are being offered there. You have to go into the center, have an evaluation, have regular imaging of your head and it has to be early stage cognitive impairment for those. So there's a whole process to go through for those newly approved medications. And the studies are very promising that they are slowing disease progression. And so more to come on that because it's new. U of L does offer those infusions, as well as Morton is doing those infusions but you have to go in, have an extensive evaluation before you qualify. Some of the other medications we've used in the past, so the Aricept and Namenda, those are there. The evidence about whether or not how much they help, it's kind of equivocal in the literature, but we haven't had a lot of treatments to offer people, so we've been using them. And I think from a geriatric standpoint, if you go to your doctor, when you go to your doctor, take your medications with you. I can't say that enough. All of them, whatever you take, put them in a suitcase, in a bag, take them with you so that they see what you're taking. It is so helpful, and I'm sure if you all have gone to any different healthcare systems and they log into that electronic health record and they pull it up on the computer and they ask you your medication list, how often is it right? It is?
You're the sign next year.
Because you make sure of it. Well, every time I go to my doctor, they say, "Are you taking this medicine?" I said, "No, that was after I had a surgery." "Are you taking that medication?" "No, that was prescribed 2 years ago." Every time, and then it just magically shows back up on these electronic health records. So it's very helpful if you can take your pills with you so that they can see what you're taking. Did that answer your question, or you have another specific question?
Well, I suspect that there's probably a universe of medications that you deal with more as a geriatrician than a normal internist. And, medication that's advertised for cognitive benefits and all the rest of that stuff. So I suspect some's good, some's bad, and some's ugly.
I think as a geriatrician, we actually are probably the opposite. We probably deal with trying to find ways to get people off of medications. I think I spend more of my day thinking, what can we do to eliminate some of these medications? people end up over a lifetime getting 20, 30 medications, and all of those interact. And as you get older, your body changes. So we always hear pediatricians always say, you know, kids are not just little adults. Well, at the other end of life, older people are not just wrinkled younger adults. They're not. They're different. Physiologically, your body changes as you get older. So all of your medications interact differently. So a lot of geriatrics is taking that less is more approach to care. And it's challenging because the way the health system is set up with 15-minute office appointments, it's hard to manage that. And that's where you want to make sure you find the right person to work with you in the healthcare system to say, hey, I'm going to sit here and try to go through these medications and look at what we can get rid of, what we need to add when it's appropriate. But we spend so much of our time, I think, trying to pull back.
I just wish more internal medicine physicians can talk to people with, geriatric issues, because as far as my experience with my father, they over-medicated him to the point that he actually had some renal failure, and it was temporary, luckily, but it was because they medicated him. So, and they just, it's like they forget that older people don't need as much medicine sometimes as.
You're right, and that's where I said the body's different. Yeah, so she said that she wished there were more people, the interns that would talk to geriatricians and hear about geriatric issues. Her father, it sounds like, was given more medication than he may have needed and had some kidney issues related to that. And I think that's where, older adults are different. The physiology, your bodies are different. You have to look at it and say, okay, these are the medications, this is what I would give a 40-year-old who's healthy and active, but even the healthy, active 80-year-olds, the body's different. It's age. No matter what we do in medicine, the body ages, just like our cars age. We can do all the care in the world for our cars, but they still age. And that happens with our bodies too. And so because of that, we have to recognize those differences and really tailor to the person. And that's the geriatric philosophy, right? Looking at it holistically and acknowledging those differences. I think you were next, huh?
I've been very fortunate to know 3 people who received the Traeger Optimal Aging Award. I just was curious what all the criteria was for that.
So the Traeger, the Optimal Aging Luncheon is coming up, I believe, on September 13th. So it's held every year. And gosh, I think we're probably up to, 15 years maybe. I can't remember how many years we've been doing it. And it's for those over the age of 85. So feel free to nominate people who just are aging well. And their criteria, I think, is pretty, you're probably on the committee, aren't you?
I am, and one of our recipients for past nominees is right there, Ms. Kirby.
Oh, very good. So
We
one of
got
the,
her, I think, about 3 years ago.
okay. So she was an awardee, a nominee over there. I don't know that she's gonna disclose her. Are you gonna how old are you?
Ms. Kirby, how old are you? Your age, 94.
She'll be 94. So, and the Optimal Aging Luncheon, I'll tell you, it's a way to nominate. So if you go on that website, you can find out about the Optimal Aging Lunch, and then they'll start taking nominees probably in the spring for next year. But it's always a wonderful event to go to with so much, I think it's just so much positivity there about people who've done so many things in life, and just honoring those people who've done amazing things. And I'm always inspired when I leave that and just feel like, oh, there's so much more. And sometimes I feel like, wow, I really need to get busy because they do so much. It's pretty amazing. Okay, there's another question. Huh?
I ask how many residents are here. I see 3, I know from the first floor. I'd just like to know how many are here. Could they raise their hands?
So she's asking how many people are here that are residents here.
Well, that means there are 4 of us that I see. And that's kind of typical of this group. They hibernate. They have most of their meals indoors. The chef has tried to get everybody to come to the dining room for breakfast and offering a cold cereal breakfast, and that's what they do now. And also, the nuts and all of the healthy Mediterranean type foods, we have had a discussion with the director. She's trying, maybe she'll do one every week or 2 weeks. And usually it's a salad type thing instead of an entree. So, I don't know, I've never run into people who are like hibernating, no matter how old they are. And that's rather depressing here.
So I think that's a challenge. I'm sure some of the Nazareth people are hearing your concerns about the food, and we'll pass that on. I will say that, you know, that hibernating, I know that Nazareth encourages people to get out of their rooms and be involved. So I'll tell you, if Benny doesn't mind me, do you mind me talking about you? So my mother-in-law is Benny Healer back here in the wheelchair. So she's been here 2 months. 2 months. Has been very active and involved. And I think that you don't hibernate, you come out.
I'm sorry, what?
I said, you don't hibernate, you come out of your room.
Yeah, as often as I
She
can.
goes to the Jewish Community Center for lunch.
Oh, that's good. That's good.
Exercise too.
And exercise.
Yeah, that reminds me, if there are 5 people for the exercise class, that's like 1 in 10 months. Usually it's 2, and sometimes it's just me.
It is just about encouraging, meeting your friends, coming to call them to come out of their room. Sometimes that's what it takes.
They're like asleep at the wheel.
I'll say, since Benny's been here, she's been pretty active. Whenever we call or text her or find out, she's like, oh, I'm going to this activity, I'm going to that activity. So it's been a good transition, but sometimes when people transition into this, and I think since COVID happened, we all have to acknowledge that impact. I mean, I'm a medical director of several facilities in town, and that now that COVID's still here, it didn't go away, we all know it didn't go away, but how do we learn to live with it? And there's still that trying to encourage people in facilities, like how do you come out, go eat, be social, right? And it's just because I think there's probably a little inertia, people got comfortable, or in COVID they were isolated, and sometimes it just takes that effort and energy to get back out into things. And that's all I can say is keep encouraging and inviting. And I know that Nazareth does a good job of trying to get people to come out, but sometimes you can't really kick people. We can't do that, so that's a hard part, but it's just how do you motivate people to come out and just keep inviting them. I think that's all you can do, and if you're here, invite a friend next time, right? Just what can you do to bring more people out?
I think some people are a little paranoid about catching COVID though when they get into the room.
Right? He said that some people are paranoid about catching COVID. I think so those of you who haven't heard, the new COVID booster was approved, I think a few nights ago. So it should be available at your pharmacy sometime in the near future. So if you're over the age of 65, it's time for the booster.
Walgreens has, I have an appointment next week. I think we're taking appointments and starting.
Right after.
So Walgreens, so call your pharmacy, and so get the booster because that's helpful. That's how you protect yourself against the severe illness. And then if you're uncomfortable, people can still wear masks. I still wear masks when I see patients. I think it's helped me be healthier, and then we're not spreading other stuff around. Because we think about COVID, but there's flu, there's lots of other viruses that now that we're doing all these respiratory swabs, we're seeing diagnosed that we never saw diagnosed, 10 years ago. Okay. Other comments, questions?
I have one more, I'm sorry.
Yeah.
On,
She's gonna bring you a microphone.
okay, probably loud, I
So on slide 34, I like how you called it the 6 pillars. So I didn't write them down. I want to make sure I have the 6 pillars right. So I'm going to make sure. I know sleep's one of them, but there's a few others.
There's sleep, stress management, social engagement. They're on that one slide. They're kind of hard to, let's see.
You're on the next slide.
I couldn't see it on the paper one.
Here, I'll pull it up here. So it's the eating, right? Nutrition, so healthy eating, physical activity, so get moving, managing stress, which I think we all can learn more about that. Having those relationships, so getting out, improving your sleep, whether it's sleep routine, melatonin, working on that, and then avoiding risky substances. So those are the pillars. The pillars of lifestyle medicine.
If you think your doctor's not interested in reducing your medication, who would you possibly see that would be interested in doing that?
So, I mean, you're always free to come, take a consult at the geriatric office, so there's information, go to the website. Some patients will come to our office and see people once a year, twice a year, just come in for that medication once over, because we really take that, it's a different perspective. Unfortunately, at this point, pharmacists do not get paid for doing, a comprehensive medication reconciliation. If you've been coming to these talks, I know Demetra Anthony Sierras, who is a geriatric pharmacist who works with us at U of L, she's done a talk here before on polypharmacy and medications. And, that's a big thing. She loves to look at people's medicine and look at and say, hey, these are things that might interact, and these are things maybe you shouldn't take. But unfortunately, she can't, the way the health system is set up at this point, get paid for that time. So, that's a thing. If you're into advocacy and can talk to your congressman, those are things to talk about, the things that we should change. Why can't pharmacists be paid for that to help balance that? But geriatricians are always happy and to do that consult. Keep your PCP, but come and get that geriatric look at things. And so,
Don't you think you have to maybe insist with your doctor?
well, you always should insist. And I'll tell you, if, just like relationships, I'll say this, doctor, patient, nurse practitioner, patient, relationships are kind of like marriages, right? Sometimes they don't go as we had hoped, and sometimes they're not a right fit. So if you have somebody who doesn't want to listen, maybe you have to find a different person to go see. And it's okay. Your doctor should be willing to listen to you and hear your concerns and take the time. Even though it may take a special appointment, so sometimes we can't fit that in. Maybe we schedule an appointment to look at those things, but and if they don't, maybe that's not a good fit. But you want to be a good advocate for yourself and your own health care, for sure.
Yes, and there's a lot of people that or just go in and listen to the doctor and not really interact with the doctor. I mean, doctors see so many patients, they don't.
It's hard. It's really hard the way the health system's set up, where it's 10-minute visit, 15-minute visit. I mean, how do you get the time? It's a challenge.
Okay, we get an annual Medicare,
If we get an annual Medicare visit, it would seem to me that it would be appropriate at that time, but what is that visit supposed to cover?
So the Medicare annual wellness visit, so if you haven't had one, you should get one. It's a visit that really looks at a lot of risk and lifestyle stuff. So the Medicare annual wellness visit was really geared toward a lot of the things I've talked about today. What are safety things you do? Do you wear a seatbelt? Do you have smoke detectors? Are you at risk of falls? How are you doing from a brain cognitive standpoint? So that Medicare wellness visit is a time to look at those. So if you haven't scheduled one, ask your doctor. Medicare covers them, and they're great in that regards, but a lot of people haven't had them. You can have your first one when you turn 65, but after that, they're just the annual one. But it's a great time to look at those things.
But could you insist that you have that your medication review?
You should. It's part of it. And actually, I would argue that a medication review should be part of every visit. That's the tricky thing about finding the right person to take care of you, to make sure that they're looking at the medications. And you know, if you go to in the city, we have to acknowledge there's different health systems. So if you go to get one part of your care here, another part there, another part here, and even though we're electronic, I think the communication was better back when we had paper. I sound like I'm starting to get to that point where I'm like, I wish I had paper charts still. And a lot of the younger doctors that come through have never seen a paper chart nowadays. So times are changing, but it's not made communication any easier. And that's where you really have to be as a patient or as a caregiver of a patient, an advocate for that person to say, hey, these are the medicines they're on. This is what happened at this other doctor. And just insist upon, like you said, insist that they look at your medications and that they listen to you. All right. You have one?
Are there any specific over-the-counter or prescription medications that you would say to avoid?
So he asked if there's any prescription medication, and did not prompt him to say this. So just what? They're over the counter. That are over the counter. So over-the-counter medications to avoid. I mentioned one earlier, which is that diphenhydramine or Benadryl. A lot of your medications like Tylenol PM or ibuprofen PM, those PM medicines have Benadryl in them. And that is medication that is called anticholinergic, but that means it can cause confusion and can cause falls in older adults. So those are ones we generally say to avoid. Other over-the-counter medications to avoid as you get older are the NSAIDs, the non-steroidal anti-inflammatory medications. So that's your ibuprofen, Aleve, naproxen. And the reason that we recommend avoiding those is because they can hurt your kidneys. And as you get older, you have older kidneys, just like the rest of your ages. So your kidneys don't process them. So those are risky medications that we try to avoid over the counter. So if it's a Tylenol PM, so Tylenol is probably the safest over-the-counter pain medication that's out there. But if it's a PM, that's the one that has the Benadryl in it.
I just wanted to say something about activities. We have a lot of new activities and performances lately. I think it is important to know that it isn't necessary to have something an activity on a every week permanent basis, because I think a lot of people would like to try new things. One of the employees today mentioned that he likes to write poetry on the side when he has time. He would like to help residents get together and do something like that, learn and share what they know and have on different subjects in a poetry type environment. But that's an idea of something new.
That's great. I think that, they'll hear these things from the Nazareth perspective, but always in my facilities, I encourage people, if they have a similar interest, talk to somebody, because they're likely to get you paired up with somebody else who has similar interests that you can get out of the room. We encourage people not to hibernate and find those interests. Absolutely.
Thank you, Dr. Morton. Great information. Lots of information to take with us. So thank you so much for your time today.
And thank you all for being a great audience and asking questions and participating. So I'll be hanging around here a minute. I know they want you to complete